Hi, my name is Jasmine Lord. I chose for my change project to be implementation of bedside reporting. I chose this topic because my current facility does not use bedside reporting as a standard of care, despite the endless amount of literature supporting the topic. What is bedside reporting? It is the exchange between the oncoming and outgoing nurse to be done with the inclusion of the patient. It also empowers families and patients in healthcare decision making. Why bedside reporting? The Joint Commission recommends patients to be actively involved in their care and the use of a standardized handoff communication process during the change of care providers. Bedside report addresses both of these requirements. The benefits of bedside report include opportunities to visualize the patient and include the patient and family in an exchange of information and care planning, can improve patient satisfaction through involvement in care, improve nurse-patient relationships, and reduction of discharge times because of improvements in patient education. It also can enhance shift handoff and improve patient safety, outcomes, patient and nurse satisfaction, time management, and accountability. Due to my facility not utilizing bedside reporting as a standard of care, the aim of this project is to incorporate the use of bedside reporting to increase patient satisfaction. After understanding the significant benefits to bedside reporting, the outcome of this change project can be addressed. The outcome is to improve patient satisfaction through the use of bedside reporting. During the planning phase of this project, it was necessary to identify steps needed to implement it. The fundamental questions identified were: who will be responsible? The identified answer is 3 designated registered nurses for the purpose of this project to implement bedside reporting. Those responsible will stress the necessity of bedside reporting to those reluctant to participate. When will it be done? It will be implemented during every shift change through those that are designated. Where will it be done? It will be done at bedside, of course, actively including the patient and their family members, if allowed by the patient. Who will collaborate? Any nurse participating in the bedside reporting process. How will the outcome be measured? A short survey before and after bedside reporting will be provided to the patient to determine patient satisfaction level based on bedside reporting. What is expected once the change is implemented? Similar to the literature, that bedside reporting will increase patient satisfaction. The next slide will go into more detail on outcomes measurement and expectations of this project. This is the short patient satisfaction survey that was performed before and after bedside reporting. Above the solid line are questions utilized before report to assess patient's baseline. The questions following the solid line are questions for after report to determine if bedside reporting had a positive effect on the patient. The hopes and expectations of this project are that the scores will be better than the baseline scores. So, what were the results of implementation? The number of patients with better after bedside report survey scores than baseline scores was 29. The number of patients with unchanged survey scores before and after bedside report were 3. The number of patients with worse after bedside report survey scores than baseline scores was 0. The total number of patients surveyed was 32. So this means that 90.6% of patients participating in this project had improved patient satisfaction scores after engaging in bedside report. To maximize the effectiveness of this project for future use, it's important to identify ways this project can be improved and sustained. Challenges that exist are: a challenge in bedside reporting is the potential violation of patients' privacy and confidentiality. A way that we can address this concern is to ask patients if they wish for family or visitors to stay or leave during bedside report. Another concern is bedside report is recommended to achieve the best patient outcomes, but concerns exist about lack of consistency in report formats and standardization in practice. We can address this concern by standardizing bedside report with a report quick sheet. Another concern is lack of staff education, buy-in, and support for bedside report. We can address this through formalized training and competency evaluation of staff on bedside report to help ensure standardization, accountability, and compliance. And even more specific to this project, it had a small sample size and can be improved through utilizing a greater population of nurses on the unit to affect a larger population of patients with bedside reporting. To conclude, bedside reporting is an indispensable tool that supports the culture of providing safe and quality care while also improving patient satisfaction through increased involvement in care. While the literature has been evident that there are several advantages and little disadvantages to bedside report, the current healthcare system has leaps of progress to make before bedside reporting becomes the gold standard. We as nurses must continue to stay informed and be accountable for the change we wish to see in the world in healthcare. Thank you.